Hopefully we've had most people join. We'll give them a couple more minutes just to dial in. We're keeping an eye on numbers, and I am Stuart Wilson and we'll be running today's session. If the background noise gets too much, then please do say. We'll try and do something about it, but we're in an open office today, so I'll apologise in advance. Mute. Hello everybody, it's Stuart Wilson. Hopefully you can hear me this time. I was muted last time, so I will try and continue now. Most people should have joined us, and if not, we'll wait for them in a minute. I am just going to restart the presentation and we'll continue from the beginning. So thank you all for joining. Just some basic housekeeping. We are recording today's session. The intention is with all of these presentations that they will be recorded, and in addition the format of them is fairly consistent, and the reason for that is that we intend to make these available as e-learning packages for both suppliers and for project teams directly. So apologies for the background noise, we're in an open office. This is the first of our environmental assessment technique sessions. It's actually on population and human health, and the intention is to give you all a general introduction to the standard that was published, I think, last month, provide a run through of the topic and the standard that is now within the design manual for roads and bridges. Broadly, the intention today is to give you some introductory information on what DMRB is all about. If you joined us for the front-end documents, the LA 101 to 104, you will have already seen this, so apologies for that. But to make sure that everybody understands the way that DMRB is now structured and written, it's worth just quickly passing over those. Then we'll move into the main purpose of today, which is actually to run through LA 112, which is called Population and Human Health. We will also give you some links and further information at the end of this, but for where they are relevant, and provide you with an opportunity to feedback both directly to standards for highways, which will be a means of highlighting any suggested improvements, and actually to one central email address which you can utilize to ask any technical questions that you might have. The intention is that we will be sharing questions rather than answering the same question multiple times, so FAQs are likely to be utilized. So moving through the front end parts, so the intention of this module is that it should be applicable to the range of people assisting in the delivery of projects, so project managers, the wider project team, which includes environmental advisors within SES and Highways England. It should be relevant to design consultants, which includes environmental coordinators and specialists, so that's not purely population and human health specialists, but the range of other topic specialists that are out there, and then contractors as well. By attending today, hopefully you'll have a better understanding of the benefits of the new approach to environmental assessment. Within population and human health, you'll have a broad understanding of the requirements which projects need to go through when they're undertaking an environmental assessment. You will have an understanding of how consideration of population and human health relates to the delivery of road projects, so that's why we actually need to consider it to deliver better quality road projects, and how to undertake assessment of this topic. The design manual for roads and bridges, for those of you that are not quite familiar with the new structure yet, has a number of front-end elements to it. GG 101 provides an introduction to DMRB, it guides its use, and specifically it indicates that we utilise this language of requirements and provide advice that relates to works on motorway and all-purpose trunk roads. It does have an assumption with it as well, so it assumes that the standards are being used by competent practitioners that are qualified professionals with able to work independently within the relevant fields, and that there is an expectation that you will apply your own skill and judgment. Within that, we utilise common language. So these are known as verb forms, and broadly they go from must, which reflects a statutory or legislative requirement, through shall, which is set by ourselves on our suppliers, should, which is advice expressed as a recommendation, may, which is advice expressed as a permissible approach, so you are allowed to do it, and then finally can, which is used to introduce notes which provide a short clarification of a concept or statement of facts, and essentially they're an advisory element. In terms of the implementation of new revised DMRB, so as we've always had, there is an element that new standards crop up during the life cycle of a project, often not necessarily at an opportune moment where you can just switch from the old to the new standard. GG 101 sets the way that we implement or respond to new standards, and essentially sets the scene that we should respond to them as soon as they are published, with a limited number of exceptions, which is where it's stated in the standard that you should not respond to it immediately, or where a contract has reached a stage that it would result in a significant additional expense or delay. Where an existing contract has terms which specifically apply regarding the implementation of new requirements, you would also not necessarily have to take account of it. All of our new environmental standards do, however, use a fairly common form of language, and essentially they dictate implementation forthwith, so immediate implementation in accordance with the requirements in GG 101. The practicality of that is that project teams have options. They can choose to implement the standards at the time that they are published, or you could consider undertaking a sensitivity test to confirm that the new approach to assessment, whether it would change the conclusions or sufficiency of environmental assessments, and that will be particularly useful during the examination process or the consent application process to test the sufficiency of the application or the environmental assessment. And what the broad assumption in the business cases that supported these standards being published is that they are cost neutral. They're based on statutory requirements, and they reflect existing practice, whether DMRB, major projects instructions, or wider industry standards. And in certain cases, a large number of these have been subject to major project instruction 57 and 71. So in summary, the Design Manual for Roads and Bridges now provides a standards framework with clear requirements. It adopts a common standards framework, which is the Manual for Development Documents, so that's common language. Consistent terminology must, shall, should, can, may are used throughout, and DMRB environmental standards cover three broad areas. They cover environmental assessment, introduction and general principles, which is effectively the first two sections of DMRB, section 1 and section 2. They cover environmental assessment techniques, known currently as section 3 within volume 11, and then they cover environmental design, which is volume 10. So now on to what these look like. So environmental assessment and design standards have been covered in three broad areas, as I've already said. Assessment intro and principles you've had an introduction to last week, which is 101 to 104. And we have an additional standard to add to that this month. So before the end of this month, you will also see LA 120 on environmental management plans. We have the environmental assessment techniques. Of those, the remaining ones will be published this month. So LA 105, air quality, LA 108, biodiversity, and that is it. Those are the two that remain. Oh, LA 111, noise. Those all remain to be published at the end of this month. And then finally, there are some design standards. The ones that remain to be published are LA 118 on biodiversity design. Focus of today's presentation is going to be on LA 112, population and human health. So, as you'll see, the LAs have a common structure to them. Broadly speaking, this is something that you'll find in all DMRB standards at this point. And LA 112 adopts the structure which is common to most of those standards. So 4 words provides you with an indication of what has been replaced. The introduction and background gives you the context and consideration of the environmental factor. Here I've highlighted that what we're referring to as population and human health is now known as an environmental factor, previously known as a topic. That terminology is adopted from the EIA directive and is a deliberate choice. Abbreviations is again an introductory element that provides assistance to the reader in understanding the specific requirements that we have and having common definitions. Terms and definitions does this assist the reader as well, and it supports consistent application of the requirements. Scope broadly explains what is covered by the document or standard, so it includes the detail of subtopics or elements. Principles and purpose provides the requirements that apply to all stages of assessment, so are the overarching principles. The assessment methodology goes through the stages of assessment, relating those together, and provides significance requirements for reporting. And then finally, monitoring is used as a section that provides requirements for monitoring of associated mitigation where significant adverse effects are reported. So that's a deliberate choice, that monitoring is principally associated with the statutory requirement to monitor significant adverse effects. So within LA 112, environmental assessment is a process of collecting information, assessing it and reporting it. It's meant to inform decision making and actually support the general public being involved in the decision making process, and the requirements are set out in the Environmental Impact Assessment Directive and implementing regulations. The EIA directive uses the term environmental factors to describe the range of things that we traditionally talked about or referred to as topics. Population and human health is one of those under Article 3.1, and this incorporates some specific elements that we previously would have recognised: land use and accessibility, and less clearly human health is now specifically brought into that consideration. Within the factor, there are a number of parts of factors known as elements, and broadly these are land use and accessibility, covering private property and housing, community land and assets, development land and businesses, agricultural land holdings, that's not land quality but land holdings, and walkers, cyclists and horse riders, referred to as WCHs. The second element is human health. And broadly, this covers human health profiles and what the affected communities are actually comprised of, what their current state of play is. It describes health determinants and likely health outcomes as a consequence of the intervention that we have planned. Terms and definitions, there are a range of them within this particular standard, and the ones that are probably most commonly not necessarily used in a consistent way are the ones that are highlighted here. So accessibility is a term that we've been used to for some time, but in the context of this standard, it's the ability of users to access land, property, infrastructure, businesses and community facilities. So it goes beyond the generally accepted definition of accessibility and applies it to this particular standard in a relevant manner. Agricultural land holdings, again, are not necessarily as was traditionally envisaged. It's the land and associated infrastructure which is used for the purposes of agricultural production. So that might actually be the arable farm itself. It may be dairy farming, or it might actually be the milking parlour that is associated with the dairy activity. So the agricultural land holdings are the entirety of the land holding, not solely the fields in which are either arable or dairy. Community land and assets, again, has extended in its consideration. So this is land, buildings and infrastructure providing a service or resource to the community. Examples of these that we would have focused on before were open spaces, village greens, village halls, and it was in DMRB healthcare and education facilities, but that is now clearer than it has ever been before. Development land, again, this was in DMRB, but largely in a undefined manner. So this is land identified in national or local plans, policies or strategies, which is intended for development. And that includes intensification of existing uses and land that is subject to planning permission. Those are not two, that's not all together. Those two things are, it's one or the other, or both. And lastly, private property and housing. Again, this was within DMRB, but less clearly. Here, we're now focusing on land, buildings and infrastructure for the purpose of residential use, not just purely the properties themselves. So in terms of principles and purpose, this section provides additional requirements for consultation to those contained in LA 104. There are a range of principles and purpose, but in this particular standard, the main focus is on consultation. LA 104 provides the mainstay for consultation requirements, but here we emphasise the need to undertake complementary consultation with authorities likely to be concerned by the project. It specifically includes a range of indicative stakeholders with whom consultation may be undertaken, including local authority officers and the Director of Public Health. So one of those we would traditionally have been very focused on, the local authority officers. Director of Public Health, less so. Community leaders, representatives and leaders of local interest groups. I would see that was common to most of the consultation that we previously undertook. Affected community groups, residential associations, schools, places of worship and community centres. Again, elements of those were contained within DMRB, but now they are more clear and specific. I would suggest the elements like schools and places of worship are clearer than they have been previously. And representatives of national or local recreational societies, traveller groups, so ramblers and horse riders were always focal groups that we had. Sorry, Hannah, can you mute some of the background if that's possible?
If I mute everybody, sorry, Stuart. If I mute everybody, I'll mute you too. So if everyone could mute themselves, that would be great.
That'd be great. Okay, thanks. We've got local elected officials as well. That previously would have been a focus for consultation, but now the examples include parish/local councillors, which would typically be informed on occasion about what is happening with schemes, members of parliament and local crime officers, which I've not seen as being a specific focus of development of our projects in the past. Then we've got the local police force again that I know that we have do consult with on projects, but is not necessarily a consistent focus of what we do, and certainly not in a proactive manner in which consultation is suggested here. And finally, a range of other stakeholders. So identify relevant stakeholders to the particular project that you're undertaking or proposing. So in terms of assessment methodology, I've broken this down into the two categories. We've got land use and accessibility first, and then we'll move on to human health. Broadly, land use and accessibility requires baseline data collection. It specifies requirements for a range of elements, and broadly requires, so you will not see this language in this manner within the standard, but broadly it requires you to specify or collect data on the location, type and number of assets at risk. Typically these are seen in each of the elements that we have, so it's things like the numbers of properties, the amount of community land, development land, agricultural land, and walkers, cyclists and horse riders provisions. So that's location, type and number of assets. The existing accessibility restrictions or severance, so you'll see this in a number of the elements. They describe where there is an existing problem. So this is accessibility restrictions in terms of community land which is not accessible, development land again which may have restrictions in terms of accessibility, and agricultural land. And then finally, the concept of frequency of use. So the sort of the value and what is there in the baseline requires you to have an understanding of how often these things are used. So community land and assets, we're looking at the use of those. Agricultural land, again, is not commonly used to the same degree of frequency, may be used periodically throughout the year and not every month. And then public rights of way, again, have frequency of use associated with them, which may vary significantly. This topic does provide assessment criteria, and broadly the assessment criteria can be described as value or sensitivity. For land use, the receptors broadly reflect resource size or scale, so bigger things, larger areas of housing, or where alternatives are not reasonably available are allocated higher value. Resource pressure, so where an existing resource is already under substantial pressure, so in areas where private property is in high demand, that there is already a forecast of increased numbers or demand in terms of the numbers of households, that would be allocated a higher value. And facilities that are already under pressure from existing levels of fragmentation. So somebody gave me a good example of an ancient woodland that is near to a community but is currently severed, and so access is restricted. That would be seen to have higher levels of resource pressure and would be allocated a higher degree of value or sensitivity, not because it's degraded in some way, but because it is already stretched in terms of its potential use by the community. And then the final concept is resource use. If something is used frequently, it's allocated a higher value than something that is used less frequently. There is also a second part to assessment criteria typically, which is magnitude. And for land use receptors, we do provide these for all elements together, with the exception of walkers, cyclists and horse riders. So they are common, except for walkers, cyclists and horse riders, and broadly they reflect changes in the resource. So you're either going to lose the resource, you're going to degrade its quality, you're going to change or remove key characteristics, or you're going to add severance, so that's changes in the resource itself. And then for walkers, cyclists and horse riders, it's changes in journey length. The observation has been made about the numbers being common for those three categories of users, and what I would suggest is that the journey distance that is added and used as an indicator of significance is a framework that is set at the level that's applicable to the lowest level of those. If you have a situation where there's horse riders and you think that there's something that the distances should be extended, and that is the sole purpose for which you're assessing a resource, then you should look to give consideration to departure or a suggested variation to that requirement. In terms of human health, the assessment methodology is is a more simple approach. The baseline data requirements broadly examine health profiles, so that's existing health information that is readily available. It looks at aspects like the percentage of vulnerable members within a particular community, existing health issues that they might have, and as a last indicator, income deprivation. There's a deliberate choice that some of those traditional health profile indicators are dropped out because they were no longer considered to be appropriate indicators. So there are typical health profile data around blue and white collar workers and the relative proportion in populations, but that's actually no longer strictly linked to increased physical activity or not, because there's a balance between recreational time and the physicality of the job. So there's a very deliberate list of health profile data which we are encouraging people to stick to. There are health determinants such as the spatial relationship with the community and recreational and education facilities. So essentially this is, does the community actually have access to those types of facilities? And then in terms of assessment criteria, the approach is supports currently a qualitative assessment. We had an ambition to move it towards quantitative assessment, and were not supported in that particular approach, but we have an aspiration to move to that position at a later stage. So the way of saying that is that qualitative assessments are supported by the current data availability, and in future we will look to make that quantitative. The difference being that we can describe broadly the scale of change with a qualitative assessment. With a quantitative assessment we can describe with a clear idea of health outcomes the nature of the change, so we can quantify it in terms of health effects, in terms of human life loss, additional hospital admissions, and other common quantified data. So the assessment criteria for human health looks at changes to health determinants, describes the changes as a result of the project. So it's, do we broadly think that admissions will go up or down or stay neutral? Looks at the sensitivity of communities, so it assigns a low, medium or high sensitivity for communities or populations, typically on the ward level. It looks at likely health outcomes, so the overall summary is as a result of the baseline situation, the sensitivity of a particular community and the change we're likely to impose on that community. Are we likely to be in a positive, neutral, negative or uncertain position? This should be provided for each of the communities or wards down the length of a project or that the project sits in, and should be associated with both direct and indirect effects on community or wards. The best available data that we have, or the lowest common unit of measurement, is ward information, and the expectation is that you will present and assess likely health outcomes on the ward level. The reason why qualitative assessment is actually deemed to be acceptable in this case is actually what we're looking for is not is for environmental assessment to not be an end to itself. The reporting of significance, whilst a statutory requirement, is not actually the intended outcome of the EIA directive and the regulatory framework. What we're looking to do is make sure that the decision maker is sufficiently informed, the public are involved, and ideally that we actually feed that information back into the design and mitigation process. So what we're looking to do is feed the human health assessment outcomes back into the design and mitigation process, and specifically looking to support the mitigation hierarchy. So in this case, what we're looking to do is avoid and prevent effects or detrimental effects in terms of health outcomes through consideration of alternative design route options that avoid severely severing highly sensitive communities and avoiding compounding existing health issues. So we have two considerations there, two primary considerations: avoiding things that are sensitive and making sure that we don't exacerbate where somebody is already in a sensitive position. We also should be looking to reduce, so reducing the effects of severance or isolation, or minimizing health effects through mitigation provision, such as noise barriers. The provision of a noise barrier can lead to avoidance of health effects. The degree to which you have confidence in that and the degree to which they avoid those health effects is the element that can be described. And then finally, we should be looking to remediate. So again, not necessarily a concept that human health is necessarily looked at in the past, but essentially this is the provision of replacement facilities where they might otherwise impact on health determinants. So if there is a loss of a facility, then we should be looking to make sure that that is replaced in some way in a manner in which it avoids impacts on health determinants. So in summary, the population and human health is made up of land use and accessibility, and then human health. Those are the two elements. The land use and accessibility has specific significance criteria supporting a quantitative assessment and reporting of significance. So it has the typical value, strict sensitivity and magnitude framework, which come together to allow you to assign significance. The human health provides a qualitative assessment describing likely health outcomes. One of the key things that we have based this on and reference sources is the IEMA Health in EIA paper. That's linked in the presentation. You'll be able to access that. And we have started dialogue with Public Health England to look at scoping future improvements in the methodology to see if there is a transition that we can make at a later stage between the qualitative method and the quantitative ambition that we believe we should have. If you do have any questions, suggestions or general feedback on the standard as it is at the moment, so these are whether they are improvements, clarifications that you would like to see or suggested changes, then please do put those through to standards inquiries email. And we have opened up the DMRB topic-specific questions and answers mailbox. So if you've got anything that you want to ask us, you want clarification, you've got a specific point to make, we will take it through the environment mailbox and we will get questions back to you or answers back to you and make sure that they're available to other suppliers in the form of frequently asked questions so we can try and get common understanding. What we should be doing is that the standard should stand up to scrutiny. There are clear definitions and there is a clear procedure for what you're expected to do. And so there should be hopefully little in the way of clarification that needs to come through the environment box, but we're always happy to take feedback through that particular route. So we are now at the end of the presentation. What I'd suggest is we have an intention that all of the IMs that you provided will be looked at and we will respond to you in writing. But in the meantime, Hannah, do we want to go through some of the highlights?
Yeah, there's, if you look at the bottom, there are three, well, maybe the bottom two IMs. So actually the first one, there's one from Jenny Wade where she's requesting information about them. A scoping opinion, and having received scoping opinion, is it necessary to implement the new DMRB? Okay, so this is a Planning Act request, a very specific requirement to NSIP schemes, and so the under statute, the provision of a scoping opinion or request for a scoping opinion and then the provision of a scoping opinion, the environmental statement has to be based on that scoping opinion. However, common practice is that the assessment methodology then does have clarification and or variation from that point. And as long as that is presented to the relevant bodies, the interested parties, then it is perfectly acceptable to base the environmental statement on an amendment. The key there would be to notify PINS of that change and the evidence for why it is deemed to be reasonable, and certainly the DCO team would provide you with guidance and advice on actually how to handle that, but certainly that level of clarification from the scoping opinion through to the point of delivering the environmental statement has happened. And indeed, if a better assessment method comes along between the point of scoping opinion and environmental statement production, I don't think the PINS would actually wish you to undertake it to a poorer standard. The basis of population and human health was set out in
MPI 57, but based on the existing Section 3 criteria. And this is really just the same assessment methodology with significance being reported in a slightly different manner. So broadly, it's the same method, and all you're doing is clarifying the reporting or significance criteria. So it's a minor change, Jenny, but we can pick that up. Hazel, would the human health refer to air quality and noise assessments? Absolutely. This will become clearer within air quality and noise when they're published, which will be at the end of this month. The air quality and noise are not the people who should necessarily be assessing the human health impacts. They should be providing the information for human health assessment to be undertaken. It is not intended that the population and human health duplicates air quality or noise assessments, but instead it takes data and presents that in terms of interpretation and what the effect on the relevant wards or populations are. So it's a description of not the numbers of people that will be affected directly by air quality, but the broad direction of change in terms of will air quality on a particular ward lead to an improvement or a reduction in the health effects that they're likely to be exposed to. So it's not talking about numbers of lives, not talking about hours of loss. It's not talking about illness. What it's talking about is that population will be exposed to a risk, positive or negative, and that will lead to a qualitative description of health outcome changes. So either they're going to have, they may be exposed to more hospital admissions, they may have the affected population may be, the population that is subject to greatest risk, which are young and old, may be more exposed to health changes, and that's likely to be positive or negative. So if we make air quality better, then those groups would be less exposed to risk. If we make air quality worse in a particular ward, then they would be open to worsening of health outcomes. E.g. noise increase, therefore would it be worse? Noise emission increase, it would qualitatively indicate that the health outcomes will change, and yes, there is likely to be a detrimental effect from that, which would be recorded. Paul, how's the percentage of vulnerable members defined? Open space, quality of housing and work are the key health determinants. So there's detail in there, Paul, and I will answer the question separately. However, there are some points that we can pick up. So the quality of housing, absolutely. You are right that that element was looked at. There are common data sources in terms of quality of housing, but actually, when we've looked at that data, it's not indicative of the quality of that housing. Essentially, the data doesn't stack up or support the environmental assessment that we need to undertake. So we have looked at quality of housing, and that data has been discounted. Work are the key health. It seems that the task is define baseline before one screens whether the scheme would have any need for this information reflected the nature of the scheme. Overall, it's a good approach. So it is, yeah, it is in all cases, Paul, describing the baseline. So there is no case where actually screening population and human health out is likely to be realistic. Describing the community in terms of population or in terms of health effects, there is likely to always be some change, whether it's agricultural, business, or populations or human health. There will always be an influence. So I would see that addressing this topic, it should always be scoped in. And actually the degree of information that's provided should be in accordance with the standard as it's set out. What do you envisage for community asset user frequency surveys with a proportionate approach? So the standard specifies the requirement, which is that you should understand the nature of use of facilities. And you're right, Alan, that there's a bit about professional judgment in terms of frequency of use. An example would be a village hall. There are always records about how well used that village hall is. So there's usually a booking system, and access to that booking system and/or effectively the percentage of usage would give you some baseline information that tells you about frequency of use. In terms of frequency of surveys, I would see that those are typically something for you to judge whether or not it's necessary, but there should be existing sources of information in them in most cases that allow you to establish an understanding of use of that particular asset or user facility. So frequency surveys probably few and far between, not the norm, and we don't have a specific requirement in terms of the frequency surveys. Building on Alan's comment, what level of survey effort is envisaged at an early stage where multiple options are still being considered? Largely you will see this in the assessment process. It defines the study area, tells you the baseline data to collect, and broadly it is establishment of existing resources and or the baseline and describing that. That's actually, for the wards, if people are concerned about the level of work in health impact assessment, the ward-based information is available very readily. So you can extract that with very little effort, and that can be made available for all the wards down multiple options. So that is a desk study information exercise and relatively easy to do. Little in the way of survey effort. So the presumption in this method is existing desk study information, and if you judge that survey effort is necessary to confirm usage, then you would do that by exception and propose that. So during early stages, I doubt that you would have a requirement to undertake survey to inform or influence this method. We can speak over the baseline offline given proportionate approach to reporting requirements. Okay, thank you, Paul. So if everybody is okay, we've come to time to the end of the IMs early. We will respond to each of the points formally and send confirmation of that through to you, and we will share the presentation at a later date. One of the things that I do have an ambition to do, which we currently don't have, is to provide better illustrations of the reporting of this particular topic. It is only now about 19 days old in terms of published standard, and so we should be coming to the point fairly shortly that we have clear reports that pick up and respond to the standard, and we can make those available to others so that you can actually see how this comes out. But typically the health impact assessment methodology is already well established through MPI 57, and the assessment of community assets broadly, that's already been covered in section 3. The good stuff that we have is that hopefully you appreciate that we're no longer doing elements like driver stress and some of the other topics within section 3 that did not relate to EIA significance, and so we've taken away from some of the work that you would have previously been expected to do and focused the assessments back onto the essential elements that inform a determination of significance. So thank you all for your time today. Yes, I agree, Jenny. Driver stress is a great one to not have. So thank you all for your time today. Cheers then.